Statistics from 2015 indicate that nearly 28 million Americans were classified with a substance use disorder, which is equivalent to nearly 75% of the current Canadian population. With the world's current circumstances, undoubtedly these numbers would look vastly different. A substance use disorder is a mental health disorder that affects a person's brain and behavior, leading to a person's inability to control their use of substances. Within this presentation, I will be discussing varying forms of interventions, including SMART recovery, DBT coach, motivational interviewing, mindfulness-based intervention, and contingency management. The first article, titled SMART Recovery, Continuing Care Considerings for Rehabilitation Counselors, discusses self-management and recovery training. Total abstinence for some individuals can be problematic, and as they may require prescribed narcotic pain medication or others with abuse potential as part of their treatment and rehabilitation plan. Contrary to 12-step models, SMART Recovery does emphasize the importance of abstinence, but does not require it as a goal for members. The SMART philosophy emphasizes harnessing individual empowerment using cognitive behavioral and rational emotive techniques to foster change in abuse patterns. The research was conducted to determine the referral potential for SMART meetings. When the 81 participants asked how confident they were in the program meeting their recovery needs on a scale of 1 to 10, the score was a mean 8.16. Of the 81 participants, 64 reported they had attended another type of recovery meeting, but switched to SMART meetings, with the major difference from other peer support meetings due to their own personal difficulties with surrendering to religious affiliations and a powerless identity. Overall, the article presented strong points of SMART recovery, being the accessibility for those who may not be abstinent from drugs or alcohol, as well as the potential for daily meetings in some communities. Weak points lead to the lack of research on the efficacy of these meetings and the impact on individual recovery. Critique of the study involves the assessment of participants who are predominantly male, 67%, white, non-Hispanic, 90%, and all had to be over the age of 18, and this does not equate to an anti-oppressive lens. The connection to social work practice includes the information being applicable to potential clients we feel can benefit from this type of peer support meeting, those who may not be attracted to the idea of a higher power or powerlessness. Furthermore, individuals who may be on narcotic pain medication or be involved in a medication-assisted treatment can still attend these meetings. Based on the fact that SMART meetings focus on connecting past events to present circumstances, encourages a trauma-informed lens, as well as Erickson's psychosocial developmental theory. Next, I review the article regarding a pilot study of the DBT Coach, an interactive mobile phone application for individuals with borderline personality disorder and substance use disorder. The photo you see on this slide is the actual app's icon. Borderline personality disorder commonly co-occurs with substance use disorder, with comorbid rates as high as 67%, resulting in even greater risk of dysfunction and risk of completed suicide among this population. Dialectical behavior therapy involves many components, one in particular being skills training. This is to enhance the individual's capability through acquisition and strengthening of effective behavioral responses. OA, or opposite action, is an emotion regulation skill taught in DBT to change unwanted negative emotions in the moment by behaving in ways that are counter to the emotion's action urge. The purpose of this pilot was to determine if participants had a decrease in emotional intensity and urges to use substances as a result of the app. 22 participants were involved in the study and found that the app was helpful nearly 97% of the time, and they experienced a significant reduction in urges to use over the course of the trial. Critique of the study involves the sample size being small, and all participants were female over the age of 18 and 77% were Caucasian. The lack of diversity does not represent an anti-oppressive framework, and due to the participants having prior experience with DBT and were taught about OA skills, it's possible that the findings were not due to the DBT Coach app. In addition, based on the idea that this app is complementary to ongoing DBT treatments and that a cell phone with Wi-Fi or data can pose a challenge on marginalized populations who do not have access to either. Having awareness of this app could pose as beneficial for some clients with the experience and knowledge of DBT and skills. Being informed of this app could better support clients utilize their skills for the potential for greater success in recovery. In this article titled "A Perspective from the Field, the Disconnect Between Abstinence-Based Programs and the Use of Motivational Interviewing in Treating Substance Use Disorder," the authors discuss how motivational interviewing, or MI, is best used with harm reduction approaches and how there is a disconnect between abstinence-based programs. The main argument surrounds the four main principles of MI and the disconnect between abstinence-based programs. The principles include de-emphasizing the use of labels and treatment to assist in reducing the stigma attached to substance use disorders, increasing individual responsibility resulting in self-determination and individualized care, increasing internal attribution where clients are responsible for their own situations and future changes rather than placing responsibility on external factors, and increasing one's awareness of cognitive dissonance where they find consistency between desires and actions in an affirming environment, free of judgment and punitive tactics, increases client motivation for change, and is an essential part of harm reduction in MI. The authors state that these principles are the foundation for helping clients increase their motivation to change, resulting in an increase in self-esteem, self-efficacy, increasing clients' awareness, and connecting inconsistencies to behavior change. The argument presented in this article was lacking in regard to comparative information to abstinence-based programs. Furthermore, the article was opinion-based, which I did enjoy. However, no study was conducted to review any limitations. Motivational interviewing has a potential for great impact for social work clients. Based on the information provided in this article, it presents a client-centered approach which complements our standards of practice, which state social workers uphold each person's right to self-determination consistent with that person's capacity and the rights of others. Social justice is incorporated into MI in way of breaking down labels for individuals with substance use disorder. The next article, with a lengthy title, Moment by Moment in Women's Recovery, Randomized Controlled Trial Protocol to Test the Efficacy of a Mindfulness-Based Intervention on Treatment Retention and Relapse Prevention Among Women in Residential Treatment for Substance Use Disorder. This article discusses a mindfulness-based intervention they created titled Moment by Moment in Women's Recovery, or MMWR. Mindfulness offers learners a method to cultivate consciousness in daily life using the practice of meditation and paying attention on purpose. The researchers who created the program want to see if it improves recovery by increasing retention in treatment and reducing relapse rates, specifically in women. Why women? Women accessing treatment due to more complex trauma histories than men, with 58% experiencing depression, 70% have experienced physical abuse, and 54% sexual abuse. In addition, the author suggests that women accessing treatment are more likely to be homeless, on probation, and have involvement with child welfare. They state that women of racial and ethnic minorities are less likely to complete treatment than Caucasians. Critique of the article begin with the fact that no results were indicated. The proposed participants consist of only females between the ages of 18 and 50. The emphasis is on racial and ethnic diversity, but researchers indicate no prisoners can participate. This does not involve an anti-oppressive framework based on the exclusion of males, those over the age of 50, and individuals who are incarcerated. Mindfulness has a connection to social work as a teachable opportunity with clients, not just those with substance use disorders. This can be implemented as a program within organizations to improve accessibility for clients, although it would be ideal to have someone certified, however, it's not required. The final article I reviewed was a general literature review on several interventions titled Evidence-Based Psychosocial Interventions in Substance Use. I'll be focusing on the one I find most interesting, being contingency management. This intervention is also referred to as voucher-based therapy. Contingency management is based on principles of behavior modification, which encourages positive behavior by providing positive reinforcement when clients progress toward treatment goals, or by providing punitive measures when they engage in undesirable behavior. Examples of positive reinforcement often include vouchers, privileges, prizes, or modest financial incentives that are of value to the individual. Strong evidence supports this approach as being effective for opioids, tobacco, and polysubstance use, being multiple substances. Limitations in this review include lack of information for some interventions and lack of any theory implementation. Very little statistical data was provided, but it was mentioned that there is strong evidence of CM being an effective treatment, but no study information was given. In addition, due to the potential cost of this intervention, it is not widely used. There was no mention of implication of professional values, and it lacked insight of its accessibility. This intervention's connection to social work includes the knowledge of what the intervention entails and who may benefit most from contingency management if available in your area and is accessible to potential clients. In summary, there are multiple interventions available for individuals struggling with substance use disorder, and based on the variability, we as social workers can be informed to meet our clients where they are at to decide what treatment options may be best for them and best suit them. Maintaining a trauma-informed lens is important when assisting this population, as well as working towards social justice by reducing the stigma of accessing help for recovery from their disorder.